Welcome, and thank you for tuning in to our video series, developed for nurse preceptors to advance clinical teaching excellence. Your commitment to supporting the development of nursing students is needed now more than ever, and the School of Nursing faculty look forward to partnering with you to ensure you have the resources and tools needed to facilitate the development of the next generation of nurses. Let's get started. The objectives of this video series, which will occur in a sequence of 3 videos, is to describe your role as a nurse preceptor, to describe legal and ethical considerations as a preceptor, outline strategies to strengthen student nurses' clinical reasoning, apply evidence-based strategies shown to strengthen student nurses' clinical reasoning, and utilize JMU School of Nursing clinical evaluation tools. Preceptors are a critical bridge between nursing education programs and clinical practice and facilitate the application of concepts, supervision of student clinical practice, and evaluate student performance of their clinical objectives. Understanding the life cycle of your role as the preceptor will ensure a strong partnership that supports student success. Phase 1 focuses on forming and building a relationship with the student and identifying the learning objectives or goals, collaborating with the student to determine ways these goals can be met, and ultimately what the evaluation criteria for that given day are. Phase 2, or the working phase, is where your role emphasizes providing learning experiences that align with the goals and align feedback with the student's clinical practice. Feedback is given throughout the day, and at the end of the clinical day, an assessment of student performance is given using a standardized rubric. We will talk more about coaching and evaluation in videos 2 and 3 of this training. Phase 3, or separation, includes reviewing the overall goal attainment, highlighting areas of improvement and ongoing growth. Depending on the course, you may be working with the student one clinical day or many days, and this will be communicated with you by the course-specific faculty. Just as you need knowledge and skill to thrive in your role as a nurse, preceptors also need specific knowledge and skills. These include understanding your role. That setting of professional boundaries is important as you may be working with your student as they encounter personal issues or stressors. Emphasize that your role is in providing rich learning experiences, structured feedback, and evaluation to improve their professional practice. Effective communication skills, including active listening with empathy and providing space for open dialogue. Preceptors also provide constructive feedback that is supportive and facilitates a growth mindset. Preceptors also recognize the power of their presence, body language, and tone in creating a supportive atmosphere. Modeling conflict resolution as a team member is also an important part of your role. Coaching and teaching strategies. Role modeling is an important part of demonstrating best practices in clinical excellence. Preceptors support the development of a student's critical thinking and ability to set their own goals and meet them. Clinical supervision and support. As preceptors, you assess and guide the student in clinical competency development. As part of that process, you also provide feedback and evaluation. You will be monitoring that student's progress throughout the day, meeting their daily objectives. Feedback must occur regularly throughout the shift, allowing the student the opportunity to demonstrate their knowledge and skill in practice. All relationships are built on that foundation of trust. In building a positive precepting relationship, establishing trust and creating a safe environment are key so that students can ask questions and learn. And lastly, confidentiality and ethics guide the integrity of the student-preceptor relationship. Personal or sensitive issues may arise, and respecting the dignity of the student's development is important. In this series of videos, we will delve further into communication, coaching, teaching, feedback strategies, and evaluation tools that will guide an effective preceptor-student relationship and to help further your reflection on how you can also provide high-quality guidance while fostering a positive learning environment. First, we will consider legal and ethical considerations. This very practical overview gives you information on the regulations concerning the clinical practice of students, as outlined by the Virginia Board of Nursing. Students are responsible and accountable for safe performance of those direct client care tasks to which they have been assigned. Of importance in your role as preceptor, you are responsible and accountable to make sure direct care tasks are assigned based on evaluation of the student's clinical knowledge and skill. As you begin in phase 1 of working with your student, be sure to review the course objectives, and the students will also have a clinical skills checklist that gives you information to which the student has been introduced to a skill. The student is also responsible for communicating clearly a skill that they have learned or not learned. If they have not learned a skill, they are not able to safely practice that skill. Students also have daily objectives that are structured based on their level of the nursing program. These are designed by the faculty. The objectives guide what the student is responsible for performing in the clinical setting. So while the preceptor is providing that clinical learning experience and supervising the student, ultimately the faculty is responsible for maintaining integrity of the clinical experience. If you have any concerns with student performance, knowledge, or skill, this is to be communicated with the faculty directly. Next, we will shift our focus to an important policy related to student privacy. The Family Educational Rights and Privacy Act, or FERPA, is similar to those laws that govern patient privacy, or as you're very familiar with, HIPAA. Similar laws do exist to protect student privacy. Student records are confidential and protected under FERPA. As a general rule, faculty and preceptors should approach student privacy much in the same manner that clinicians approach patient privacy. Conversations around student progress and evaluation are appropriate among the educational team with faculty in the School of Nursing, but otherwise should be treated as confidential. Student papers and faculty documentation and evaluation of student progress, such as grades, are treated as confidential. Please use official communication channels to communicate with the faculty, such as your organizational email. If you have an immediate concern, please contact the faculty directly via phone call. The faculty contact information will be provided to you with the clinical objectives and evaluation forms that the student will provide. So let's do a quick knowledge check. True or false? The preceptor is responsible for identifying clinical objectives and action steps for the nursing student each shift. Take a moment to pause if you need to. The statement is false. The preceptor is not responsible for identifying those objectives. The preceptor, rather, facilitates, provides feedback, and evaluates the student's performance. Those clinical objectives are going to come with the student each clinical day. Those objectives are designed by the faculty. We appreciate your facilitation, feedback, and developmental feedback to the student, and ultimately at the end of the clinical day, an evaluation of how the student has performed in their clinical practice for that day. This concludes the first introductory video. Next, we will learn more about teaching and coaching strategies.